Check one. We're good. All right. Welcome, everyone, to Perfect Storm webinar. Tonight, we're going to go over exactly what the perfect storm is. We're going to talk about some science and neurology. We're going to talk about kind of the different stages of that storm as it builds, and we'll go over some case studies as well. So over the next half hour, hopefully, we get some answers and get maybe some hope. I know a lot of families are struggling, and the majority of our practice is seeing kids somewhere along this path. And so we know the struggles that the kids are going through, and then the families are going through as well. So welcome in. I'm Dr. Chad Burkhart. I'm a pediatric chiropractor at the Wellery Chiropractic in Maple Grove, Minnesota. And I'm going to start with a video. So I'm going to share my screen. And we're going to watch this.
This is an awareness test. How many passes does the team in white make? Go! The answer is 13.
Anybody get it? 13?
You see the moonwalking bear.
There he is. And so I show that video because it starts to talk off in that vein of like, if we're not looking for some of these things, we are going to miss them. And we're able to look at certain things, not in just compartmentalize or silos and say, oh, it's just ear infections. Oh, it's just colic. Oh, it's these things. We can step back and say, hey, this is part of a bigger neurological issue. And as we're going to find out that stress, it looks different at different stages, but it's really the same thing. And so it's kind of a fun way to start. So let's share my screen again. We'll get into some slides here. This is our team. I like this picture because it sums us up pretty well. Obviously, the things we're talking about tonight, they're not fun. There's a lot of seriousness, and we do take this serious, and we take your family's health and your goals very seriously. But that kind of is the end of the list. We want our place to be, fun and engaging. And if you have a kid in the storm, you and your child have been to lots of different doctors, whether they're even early in the storm of like ear infections. They're 2 years old, they've been poked and prodded, and people have been around their face, and they've been having people come at them and behind closed doors, and it's just kind of weird. And so from anywhere from our design and our space to our team is really to put kids at ease and put parents at ease too. And we know that kids can sense that too. And if parents are comfortable and they come in, kids are going to be more comfortable. But we hope that you leave a little bit lighter than when you came in. Obviously, the adjustments help, and we'll get into that. But just being in our space and interacting with the other families and our team, it's usually some good vibes, and kids do really well. And so, perfect storm. So, perfect storm is basically that sequence of neurological stress that gets imprinted, and we're going to go over how that happens here in a second. But early warning signs of these things: colic, sleep issues. There's a big one with babies: reflux, constipation, difficulty nursing, torticollis, meaning the baby's head preference is one side. These are babies that hate tummy time. These are babies that are really what we would say the uncooked noodle, very stiff, very rigid. You can kind of hand them off in one piece. And these are the babies that are really so strong with their neck. They're holding their neck up at weeks old, and they're rolling over at a month old. And they're just a lot of tension, right? They're not that cooked noodle where it's nice and floppy, and we have to really be protective of how we hand them off to a spouse or a brother or sister. As we progress in the storm, that's ear infections is what we see next. And this is, I'd say, by far and away the most common entry point for us as far as when kids start to see us. besides maybe some colic and sleep issues, constipation. But we grow out of colic and constipation and reflux, right? But we grow into ear infections. And this usually starts that cascade of multiple rounds of antibiotics, multiple rounds of tubes. We have a couple 2-year-olds in right now that we're trying to prevent a second set and a third set of tubes, and they've had either 5 to 9 rounds of antibiotics. And as we know, you dump some antibiotics on it, that's great, they're life saving, but after 6 or 7 rounds, there's got to be something else going on, and we're really compromising our immune system and our brain gut connection and all those things. So ear infections is a big thing for us. And after that, we see a lot of just constant colds, sicknesses. These are the kids with constant runny noses. They constantly have this cough that lasts for weeks and weeks. It doesn't really go away. Respiratory infections, allergies. They're really responsive to allergies, spring and fall. And as we progress further, and as that storm builds, and as they figure out some things, then this neurological stress gets stuck and it shows up in other areas. And as we get into school age, that's when we start to see focus, behavior, can't really calm. These are the kids that go 8, 9, 10, right away. There's really a roller coaster of moods and emotions. Can't sit still. And so that's kind of how we see this storm build. And then at the end of the storm, when it's been raging for years, we see the anxiety, ADHD, ADD, sensory processing disorder, autism, focus, all these issues that are really, really tough. And neurologically, that's dug in. Those wires have been fired together for so long in that protection and that fight or flight that kids are really, really struggling. And so that's the perfect storm. It's just when we can look back and say, okay, what were they? How did birth go? What was early childhood? What was, the first 2, 3 years of life? Even though we're dealing with an 8 or 9-year-old, we like to look back and unpack a lot of that because that's part of the child's story, is all those things leading up to that. And so when we look at it in totality, and we can see the moonwalking bear, we say this has been a thing all along. We just haven't been looking for it, and we're missing it. This is kind of a continuation, another analogy of the gas versus brake. And so this is, we have 3 types of stressors. We have physical, chemical, and emotional stress. And what we find with kids that are in this storm is that the first 2, so the physical stress, a big one, a huge one, is the birth process. And again, C-sections can be life-saving, and how we bring kids into the world. I think we're normalizing a lot of that, and just maybe a manual assistance or a vacuum or whatever it might be. We're not guiding that baby out nice and gently. A lot of times, unfortunately, we're doing a lot of pulling and yanking, and there's some delicate nervous system things, as we'll talk about, in the upper cervical area. So physical stress is a big one. And then the chemical stress, like we talked about, antibiotics. Between the antibiotics and the birth process, combination of 2, that's a pretty good indicator or recipe, you could say, for having some of these neurological issues. And we feel like the chemical and the physical stress really drive that mental, emotional stress as we get a little bit older, as that storm starts to build. And, as we know, even in utero, this starts, right? So all the physical, chemical, emotional stress that the birth parent is experiencing, that baby's experiencing too. And so the fear, anxiety around pregnancy, or if we've had lots that were maybe high risk, or, we're sitting in a desk job when we weren't able to move because we had back pain, or whatever that might be, this is all imprinted on that nervous system of that baby. So the next picture is going to be a picture of a C-section. So just FYI. And so this is what we talk about, that birth process. And this is, we're not dogging on the medical system. We're just it is what it is. If you're brought into the world like this, and we're really yanking and pulling, there's some delicate tissue there, obviously, in the upper cervical. And so this is a big physical trauma that we see with kids is the birth process with these babies, and that can cause anything from torticollis to ear infections, anything on that list, because of some things I'll show you here in a second. I don't think I've ever had a webinar or a talk where this quote has not been in there. You can't be in growth and protection at the same time. So back to that gas brake analogy, that growth is the brake pedal, right? That parasympathetic rest, digest, grow, heal, and that protection part is the gas pedal, right? It's the fight or flight protection mode, and we can't be in both at the same time. And as kids, obviously, we want to be in full-blown growth mode. But if we have some stress and some trauma in that physical, chemical, mental, emotional stressors, we're going to live life in protection. And think of those babies that we talked about that are really tight, that are really rigid. They're in protection. They're not nice and loose and floppy. And so back to, kind of upper cervical, this is a fuse box. So as we know, each nerve goes to different parts of our brain, our body and our brain communicate through that. And so you can see up here, this upper cervical, C1, 2, and 3, that's what's getting yanked down in the birth process, or that's maybe we have a long labor that's, we're pushing and we have a stalled labor, or whatever that might be. You can see all this stuff in here, right? Colic, ear infections, allergies, torticollis, and you can see over here, ADD, ADHD, and so difficulty sleeping. So this is a big, big deal because of this guy, the vagus nerve. The vagus nerve is our main sensory nerve. It's the main nerve that basically communicates what's going on with the body up into the brain. And if there's a disconnect there, if there's stress in that upper cervical, that means there's stress in that vagus nerve. That means the body and the brain are not able to communicate very well at all. And that's when we have a lot of these challenges. We're made to self-heal. We're made to, babies don't want to spit up. They don't want to be crying all the time. They don't want to have ear infections and all these issues, right? But if there's a disconnect in that vagus nerve, then the body and the brain aren't able to communicate and they're not able to coordinate all those things. And this is what we see. Kids don't grow out of something, they grow into something else. And so this is quintessentially what the storm is all about, is that we're not seeing the moonwalking bear. All these things are just one thing. It's stress in the nervous system. And it might look different. It has different symptoms, but it's literally the same thing. So great. You have a chiropractor talking to you about a lot of neurological things, right? And so the way that we can confidently say we can help with these things is because of our neurological scans. And so we're going to walk through some of that, and we're going to some case studies as well. So first scan we do is a thermal scan, so meaning temperature. One of the main jobs of our nervous system is to be constantly perceiving the environment and making the appropriate adaptations, right? So these things are constantly going in and out. We don't even know it, right? So what happens with this is as you can see, we do it on infants as well. It's a thermal scan that gives us this. And so what this is saying up here is that there's significant difference in this area between right and left. So we know that their nervous system is not adapting to the environment like it should. That tells us, okay, doctor, check here first. And I forget who this was, but I can guarantee you they've had either history of or they're in a lot of ear infections, coughs, colds, because this is where eyes, ears, nose, throat go. They could also have ADHD and sensory issues because of that vagus nerve and that upper cervical. So the thermal scans tell us a lot, and we do that on everyone. When we get into 3 or 4 years old, we do this scan. This is a surface EMG. The thing that we really like about this scan, it gives us a few numbers. Hopefully not going too technical on you. This 438, think of that as decibel levels. So this is what the body is telling the brain. Are we like this, where we have a nice, smooth, symmetrical, organized, easy to understand, easy volume that the body is telling the brain? Or are we screaming and yelling at the brain and it's very chaotic? It's kind of like the difference between having background, like elevator music going when you're doing some work at home. It's just there, right? It's just there. It's nice and calming, maybe even, right? Well, we never crank that music, turn on AC/DC, Metallica, or my dad would say, stone throwing music, when we're trying to really concentrate on a task, right? Because that's so much information and so much noise going into the brain that we want to shut that off so we can focus. Well, this is what's going on with these kids that have ADHD and sensory issues, is that It's like the body is just constantly yelling at the brain. This decibel level is 11 out of 10. And so if you're going to yell at the brain all day, we're not going to be able to focus. We're not going to be able to organize and process our thoughts and our emotions. We're just in fight or flight the whole time. This is great if you want to work out, if you want to run around, but if you're trying to sit in school and focus and process things and learn and grow and develop, this is not the way to do it. And so when we have chaotic, unsymmetrical, very hard to understand information going into the brain is going to spit the same thing out. And so we use this a lot with sensory ADHD kids. And the beautiful things about these scans is that we scan every 12 visits, so we can see where the progress is, right? Okay, mom, dad, whoever, what are you seeing? Okay, this is what the objective data is showing us. And are we moving on the right path? Are we getting to where we want to go and reach those goals? Third scan that we do is an HRV, heart rate variability. And so we really want a high rate of variability. Back to that gas versus brake. We want to be able to hit the gas when we want to. The analogy I make is like when we're going down the highway, we're going 60 miles an hour. We can speed up very safely, get around somebody, and we can brake very safely, right? But if we're going 100 miles an hour, if we're in fight or flight, we're in that sympathetic dominant state, we're going to miss things. Eventually, we're going to crash, right? So this is what this HRV gives us a couple numbers as well. And so you can see we're the white dot here. We want to be up here and right in the middle. So for the middle, that means we're going down the interstate going 60. We can speed up if we need to. We can slow down if we need to. And then this other number is how high you are. And so the higher you are, the more adaptability you have, the more reserves that you have. And this is it's not a direct correlation by any means to the immune system, but we have found that kids with a higher HRV, yeah, they get sick for a day or two because they can allocate resources and say, let's go fight that bacteria. Let's go fight that virus. We're going to keep things going over here. But the kids that have a low HRV, that have a history of this neurological stress, they're fighting fires on a lot of different fronts, right? And so to add a bacteria, add a virus, or God, these kids add a transition back to school. Okay, we're not going here today like we talked about. We're going over here. We're going to do this new thing, right? Those transitions. So that too is stressful, and that adaptability isn't there if we have that neurological stress within the nervous system because it's just overwhelmed. The nervous system is overwhelmed. We can't handle and process things like we need to. So let's get into some case studies, which is a really good way to explain and further kind of the understanding of the perfect storm. So we're going to talk about here in a second, we'll show you some scans. We're going to talk about Sam. So Sam came to us when he was 2 years old. He had, let me get this right. He had 5 rounds of antibiotics. He's already had a set of tubes and came to us in January of 2020, almost right when we opened. And we're trying to prevent a second round of tubes. To give you a little background on the birth parent, mom, we had multiple losses between the first son and then Sam. Lots of challenges getting pregnant. We eventually did IVF with a donor egg, which high risk. She was over 40. We're geriatric right at that point. And so tons of ultrasounds, tons of monitoring, lots of anxiety, as you can imagine, around that. And so when Sam was born, he had a low platelet count. He had 2 transfusions. He's had a week in a NICU. So that's the start of that dude's life, right? He could already feel, like we talked about, that gas versus brake, right? That physical, mental, chemical stressors that mom was going through, he was feeling in utero. And then the first moments and first days of life were spent in a NICU hooked up to things, right? And so that's very traumatic. That's physical trauma, that's chemical trauma, that's huge mental, emotional trauma that we just can't be in mom's arms and we're laying in a bed hooked up to machines and getting transfusions, right? So that's very traumatic start to his life. And when we saw him at 2, obviously we talked about the ears and trying to avoid the second set of tubes, but also sleep was a huge struggle. Would sleep for a few hours and do the quintessential crawling with mom and dad like every night. Not growing. He was actually in the 1 percentile with growth. He was behind, behind. He wasn't talking at all. Had maybe mama, I think is maybe 1 or 2 words, vocab. real picky eater as well. And so let's walk you through his scans. And so what we did is, so this is his progression. So over here on the left is the first scan that we did in January. And you can see this tremendous amount of stress stuck in that upper cervical. I mean, this tells the story of Sam. And, a lot of things that were just like, oh, geez. One, poor guy, like, holy cow. But also the second we saw this, like, we got this. We can help. We can see it. It's right there. All the stress stuck, the ears, eyes, nose, throat, brain, gut, all that stuff lives up there. And so we were able to do 12 adjustments. And after 12 adjustments, this is what it looked like. So you can see it clearing up, right? And so this is a good point that it just takes time and frequency. Up until 2 years, so basically 100% of his life had been in protection. 100% of his life had been in that fight or flight. And so he wasn't growing 1 percentile. He wasn't able to fight off, ear infections, right? He had 5 of them, right? So he was in that protection mode a long time. So his body didn't know any different. So this is going to take time and frequency to basically rewire how his brain and his body communicate. And we need to get the stress off that upper cervical and that vagus nerve. And then there's another scan in through here, but this is this 4th month. And so, yeah, it took a while, but look at that progression. And now there's no stress in his nervous system. And knock on wood, he has not had an ear infection yet. And so this is a perfect example of someone early on in that storm where we had a lot of trauma, physical and chemical trauma early on in life. And there's a lot of stress around pregnancy. And we ended up with a lot of ear infections and almost a second set of tubes, which we were able to avoid. And so this is Sam right here. And so the first thing that mom said, even after the first month, was that he's growing. She could really notice the growing, no ear infections, minimal congestion, eating better. And this one was really hit me when I read it. And it really reminded me, like, man, this is big stuff. We're changing that trajectory of these kids, and started growing his own personality, silly, funny, chatty, right? So Sam wasn't really Sam the first few years of his life. He was living in a protection mode and survival mode, and just like adults, right? When we have a lot going on, we're stressed, and our health is not great. We're not ourselves, right? We're our mood and how we show up is not the same. And they didn't know any different. They just thought that was Sam. We actually had someone today come in, and she's with ear infections, kind of very similar to Sam. They're talking about 2 sets of tubes, and the mom said he's just chatting. He has more energy. He's just more giggly, and that's what kids should be doing, right? But if we have all this stuff going on, we're just not ourselves. So that's Sam. So early on in the storm, we were able to catch that, get him back on track. The next one, the last one we're going to talk about, is Cece. So Cece came in kind of right when Sam did, February of 2020, and same thing, multiple ear infections, lots of colds, just really couldn't. We were sick for weeks and weeks. Just couldn't really kick it. Got him scanned. Some things happened in February, March of 2020, if you guys remember or not. And the family decided, just thought everything going on, they didn't go under care. And so then we saw her 13 months later. So now she's 4. Okay. So she started with ear infections and constant colds and coughs and things like that. She grew, right? In the last year, she grew out of that, but then she grew into behavior issues, being very aggressive with the other siblings, towards mom and dad, a lot of, classic, not listening, acting out. And mom kind of put it perfectly. It's like, anxiety is showing up this way. And we're seeing anxiety early and earlier. And that was our webinar last month, was about anxiety showing up really early. And so we were able to get Cece signed up for some care and do some things. And I'll share her scans with you guys. And so this was Cece. So as you can see, I mean, it's pretty classic upper cervical stress, right? C1 all the way down to C6 had significant stuck stress. And so all you need to really know about that is that the body and the brain were communicating. There's a huge disconnect uh, between that vagus nerve and what the body's being telling the brain, what the brain was telling the body, and they weren't able to coordinate. They weren't able to get over that sickness because of, think of it this way. If I'm the body and on the other side of the computer, you are the brain, right? And I'm trying to say, hey, this is what's going on with me. I think I might need this. Can you check this out? But in between me and you up in the brain, there is one, two, three, four, there's 5 screaming kids. Okay. That's basically what it's like. Messages are going to get through, but we're going to spend a lot of energy. They're not going to be clear. They're not going to be concise when we have all these roadblocks, all this noise, so to speak, in through here. And so for the brain and the body to coordinate things, it's nearly impossible. It's kind of amazing how these kids do actually grow and heal to some extent because of all the stress that's in here. So able to get her adjusted after 12 adjustments. You can see that stress leaving her. And this is an interesting point too. You can see over here, it's a lot on the left and then all on the right over here. Now it's on the right and all on the left. And this is just her body working through this. And this is why we scan every 12 visits, because we need to know what neurologically, what's going on with that body. And this is a perfect example of her body just trying to figure things out. And after 3 months, look at this, perfect, almost perfect. A little bit of mild stress, which wasn't causing anything. So this is a great success, and you can see that progression through the scans of Cece. And mom and dad had awesome things to report about mood swings and outbursts, and seems to be less stressed. And sometimes we don't. I think kids, we say, oh, they're so resilient. Oh, they can get through a lot. Well, yeah, and it shows up. That nervous system stress, again, if it's chemical, if it's mental, if it's physical, that stress stays in there. And we need to measure that and figure out where it is and quantify that. And the scans gave Cece's mom and dad, gave Sam's mom and dad, and everyone else that comes in here, including myself, confidence, certainty that it's in there. There's objective data that shows there's stress in there. We need to get that out, and the body is going to do what it's going to do, right? We don't fix any of these things. We just remove that stress in the nervous system, unwind those babies, unwind that nervous system, and we start pooping, and we can sleep, and we can be CC instead of stressed out CC. And so that was a huge win for her and her family. And for every CC, there's 4 or 5 more. For every Sam, there's 6 or 7 more of kids that have gone, in that storm, but in that struggle, but been able to correct and get back on track. And that's really what we do here all day, every day, is just get those kids and get those families back on track. That trajectory, if we keep going and going, it gets further and away, and it's going to take more and more to get us there. But super happy for Cece and her family. So if this sounds like your kid, if this sounds like something that this is Aaliyah. Sorry, this is Aaliyah. She's another perfect storm, former perfect storm little lady. So right now we're running a $47 perfect storm special. So that gets you a phone consult with me, because we know, especially at 7, 8 years old, we want to be candid and talk about these things. So we are always happy to jump on a phone call, whether it be just to talk to see if we're a good fit, or to kind of flesh out some of your child's story. We also offer the scans and the exam. And then we'll go over the scans, we'll go over the exam, just like we did in these case studies, and we'll come up with a customized plan to say, hey, this is what we found. This is how long it's going to take. This is how many adjustments we're thinking. This is where we're going to adjust. This is how much it's going to cost. All those things are super upfront. And we also throw in the first adjustment as well, because we want you and your child to experience what that looks like. And we don't want any fear or anxiety around that first adjustment. But super happy that you guys are able to spend some time with me. And like I said, give us an email, give us a call. We're happy to jump on a phone call and just kind of further explain things or continue the conversation. Like I said, if you want to take advantage of that $47, that's going to be going now until the end of the school year. So we'll do like the first part of June, because we know this is a little busy time of year. But yeah, reach out anytime. We're happy to share any of these things with you again. And thanks for joining me.